Fambul. Good afternoon and welcome back to the second half of a program, Wel Bodi Tok, where they come to you live from Radio Maria Salon, the Christian voice na you host, na FM 90.9 na Freetown, 101.3 na Makeni, 91.9 na Bo, and 90.7 inside Kenema. Members say inside the first 30 minutes of the program, we don't look at the 8th panic topic today, where na menopause, a journey for all women. This particular program na for women then today, where the thing they happen to, but yet we need the support of the man them. And with me special guest today for help me for talk about this better one, na staff midwife Edna Stiagboyi, attached to the Oladuin Children's Hospital, na the pediatric wing na Fobe Road. And then I have for help me for talk about this journey we all women they go through. And we don't, in the first half of the program, we don't begin say the picking them can start with the menarche way around some 8 years, as early as 8 years, or some as late as 12, 13 years, and cannot begin see the menses. So in as much as we start that journey there, we hope say that journey go end. And with that, we don't go through say 2 kids in they were responsible for all waiting they happen in women them tebele the estrogen we get a greater role for play, and progesterone self gets in your role for play way belle day. So with this estrogen here, it gets greater role for play by this menopause. So we say for let the woman reach in term, when you know they see in term again, it gets 3 types. They begin from the perimenopause, before you stop for mens, we mean say you go begin to see you menses one in and out, or irregular. You go can someone the other 10 or you go can 3 days, the other 10 and 1 day, as the case may be, and you don't do 40 years and above, they begin send that signal there to you. Then menopause now where you don't do 12 months, we get uninterrupted menstrual interrupted you menses not they come at all. Then you know say even though you know they take no medicine, they not do no operation for you, no other thing, then you know say you don't reach there. Then after that, when you don't reach that side, you get the post menopause, and all the one they are getting them waking and work the women them at different time. We don't concentrate on some of the things that we can show out where one can be the temper of the woman, then the mood can swing. So woman then the mood they swing, and some can they forget. Some can get problem with vagina dryness, where this can most common during sexual intercourse with the man them, that they get painful intercourse, and this can make something, and the demand then can feel say an infection the woman gets, and way not to that na the thing, because they cry the pain because of there is dryness. Where the estrogen they enough, they perform in your duty for help for lubricates. So where you know they that's not another thing. So the woman they always get a fear for subsequent intercourse, for say it go painful, and then it go begin the fear, or it a nag. So because of that, not to the beginning and the way can fear this grumble, or the man then can say the grumble, or a sometimes they jump in that way they go to other man, then I make this, I make that, because the man don't understand the process. So and also we don't say again sometimes the son can get ear loss, the ear they begin loose cut na the head, or some they begin get some knee problem, some person the belly they begin bloated, they big, yes,
get cataract,
so they get hot flash where you go feel uncomfortable, because sometimes the type clothes where time go reach, you get for know the type of clothes where you go the wear, so you get for know you your self-care. So all of them things that we don't talk inside the first half of the program. So for talk better one inside the second half of the program, the handover on back to Edna Stiagboyi for take we through menopause, a journey for all women. For that we look at waiting na the other causes, because I know say some people go ask that question. We get the normal one, waiting where you don't reach that age, say yes you go stop natural. For see you time in natural, but yet we get other causes where they make so woman they reach menopause before the time. That it will help we follow no waiting at some of them in there. So
then let's say we've been talking about the natural causes by the definition. Then natural cause it can be chromosomal. That the chromosomes of the woman. You know, say a woman will get X and Y. Sometimes and the one part the like the X chromosome can knock can present na the woman in the woman per the woman. So this can cause menopause. It can make not able get a normal menstrual cycle. Again, we talk about genetics. We now from parents there you they get them, or from you see the other people there, four parents, four fathers, or four parents, women, we then get. Then even premenopause. Sometimes people then they were naturally. They're not they reach that in 40 years. Before 40 years, then can don't come into the then go don't get into the menopausal age. So now the natural ones and then they. But again, we get the other one when are like people then like with cancer. You know, say we get the way how then they treat them, where now chemotherapy now we they use for let we treat them, then chemicals. Instead can cause them for let them get the menopause earlier. Then operation they what they call ovrectomy. When are the ovaries then they remove. Sometimes infection can cause them, or sometimes and they say then they born people there where they not get where or the ovary absent. And if the ovary absent, when are in the regulate this now in the release these hormones then the ovary is they part of the reproductive organ. So now in the release this estrogen. So if these ovaries then don't remove them, it can lead because since now in the release them hormones then, if it not there for release them hormones then that woman they not liable for let it born. So then one thing, then sometimes then can pull the one whole uterus where itself it can lead to that. It can help. It can lead to menopause. So I think now the thing then day where we know say it can do. Then the complications really for them here we they get what we call osteoporosis. That's not the bone for big person. Now the disease condition then the way you bone then they brittle, you bone then they soft. So if they don't soft, you liable it risky for you for let you get fracture at any time. More like the wrist, the hip there, quick you don't get as you for don't know more self you don't get that accident they go make you not go you go get a fracture. Sometimes and they cause heart disease, the cardiovascular disease. When a heart disease they make you get heart problem. Most people then now then they sometimes you go hypertensive, sometimes they even diabetes, because that estrogen is low in your system. Then even like the bladder, it can make you get bladder problem where like you they begin get leakage. Some people, some women then they not to foreseen by themselves, but then they begin get leakage where wet they come out pan them, you know. Then even to the bowel, all them thing and they you just like I say you get wrinkled skin, weak vision, where like something and they you liable forget cataract safe. So now then they now the problems then where would they normally facing by this condition, now this by this menopausal condition. So far I don't stop here first until Sister Gifty talk, then we go can see how we go manage this case here. So because as nurses we not get for go tell una say una treat una self una treat. Now doctor na make we say go to your health care provider. In go able to when at the doctor in go able to tell you the medications the way you dey take. We know they talk on medications now, yeah, because we are nurses, but we they talk of about management, how you go manage yourself now us in this kind of cases, okay, and this kind of case where you get some, where you don't approach her now and where it dey in now. because some people then go there with them symptoms, yeah, it go there later, it go pass off. Some of the symptoms then go pass off, but some then they say you die, you get them symptoms and they like more like where you don't know more way we say you set hala na ya today you vex, today you don't forget usa you lay. Now then you know the member you get usa you go begin alap at them picking and say, oh, then don't teach me, oh, where at the end where you go usa you go lay am. Now then you go meet am. So far so good. Lord, we don't done with this. Let's start with this self from more far small then we can today. How you go manage yourself.
From Elders here, boy, thank you very much for taking to some of the other things that we can make woman they reach the menopause before time, before age 40. You don't explain them. So you were there out there and not say, hey, I don't reach menopause, I don't 40 years. You must get reason why. Either you get genetic problem or chromosomal problem, as you don't say, or you don't undergo certain surgeries, or you get certain medication we don't expose you to some chemicals. That one are different thing. But you will don't go through this journey as how if go, or you presently day in this journey, or in a year's time you did towards this journey, you for begin take notes now, or you get fumble where they with na us, or you na man they listen this program now, you have done they exhibit any of them thing there, yeah. So especially that way they cause the low sexual drive and that painful sexual intercourse, way not to infection as the case may be, you need for no say the menopause gets in your role, because estrogen don't really reduce. But as see how they take we through the management, you go know waiting for the outside for go. So that make always with the emphasize say not forget for go na the Wel Bodi workplace for go see the doctor, especially this the woman doctor, the doctor waiting for woman business for me go able for advice you and your partner waiting for do, and how una all two go journey together, because now a thing where una all two can journey together, not to you one no more. Yes, yeah, the viewers and listeners they wait now for no the management from the end.
The management now, you waiting na us. You get for managing first. As I say, not to we own side and they forgive you medicine. You dey go, your doctor will give you. But to we own side, how you go manage yourself now? You for manage for control, you wait. You know for day, you know for make you wait go up. You for manager, you wait for day in that normal weight where mortal man forgets. You know for put on weight. Secondly, you get for eat boku fruits and vegetable. And this fruit and vegetable, not for them thin fruits and vegetables, oh, they will natural one then.
You get for advice you
really help
you get woman they mostly inside Sierra Leone see and say for buy vegetables and fruits na extra cost.
Not for extra cost,
so
it's
more simple. So you get for emphasize
that stage.
For men know the benefits.
When we don't reach that stage, then at the benefits that day. Vegetables, like then carrots, cabbage, berries. All them things, berries. Food more we get them we contain calcium. You for the eat them. Then vitamin D. We get food then where then the vegetables and the way we contain them in the acid they take them. It help you by this condition, yeah. Exercise, you get for exercise regularly. You see down because if you not exercise, one, this diabetes, hypertension. Instead, it
plus
can help.
The weight,
plus the weight, you not control them. It will make you lead. It will lead you to this. It will make you discomfort. One go be too much. It go help. It go too much for you. So if as you exercise regularly, at least once a day, it can help you. Then you practice deep breathing, like in the morning or even in the afternoon. Try to breathe in deep, then you release your breathing. Instead can able help. Then we can call a pelvic floor exercise per woman. When you do one, this can prevent you for your bladder. Your bladder it help you bladder not for cause you not forget leakage from the bladder. So all
so
this
they help for tightening the muscle.
Tighten the
So if you
muscles.
want to know more, because you're not go able for demonstrator now, we go advise you can go YouTube and see
And
how
see
you
how
dey
you
do
dey
pelvic muscle
muscle
exercise.
exercise.
So you go know how beneficial that's between.
Then when you don't do all this, people then they still when they drink. Yes, they're not saying for drink, but alcohol intake for now you get for reducer. How you been dey take a lot or so again? If you been dey take 10 pints, at least reduce am to 2 or even 1. Or if you even decide say la just left this drinking, la left alcohol totally, because I know say it go help me. It go help me for let become more stronger in health. Then you go do am. Like rather than they smoke tobacco cigarettes again, instead enough fine, because it go cause other problem then for you where it no go fine. I feel say na the advice standing.
And the advice standing from Sia Edna Bori when I'm a special guest today. Time the catchery. However, we don't go through today. Say menopause na a journey for all women. We don't talk about the one the way they go through in the normal process, and others we don't reach there before time because of one reason or the other, because of medical reasons or some genetic conditions. However, those where they go through and naturally we don't say you get stages them, you get time where they begin, they get irregularity in your menses, they come always there. You get time where they really reach the menopause now, where they 12 months uninterrupted, they see you menses. And then you get it a postmenopausal where after you menses, instead get some other things the way like now you really don't stable from these signs and symptoms of these hot flashes and all. But however, at the postmenopausal, you get some of them things there where they experience are these complications there, where it possible say you because the estrogen not on the work again, as I say, the belly say they begin bloat, you bone then they soft, because if you not on they take vitamin D, or you not eat food where they in vitamin D, or you not on they expose yourself to sun, or you not on they take medication where get some vitamin D in them. Then also if you not on the exercise or take more of them, green, yellow, and
vegetables,
purple vegetables and fruits, all of these go able for help for see that you able for waiting. Then also these hot flashes as well. Then with postmenopausal women, they're also exposed to this say bleeding can come up at any time. When if that happen, because you be don't left for see menses there, you see bleeding coming, now a need for let you go and see the doctor for me then go screen you, may not be saying a cancer or any other thing. Then also this vaginal dryness and this low sexual drive are still insist on them, and this low mood swing, this hot flashes, and this knee problem them and all. If you go through them thing there, so you need for go see your doctor and explain to, and so now go able for iron out for let you know whose medication he go prescribe for you, whose lubricant he go prescribe for you, for let things go on. And always ensure they say this journey for be a pleasurable one. This journey you for go through with your partner, way for understand you, if for know waiting at the signs and symptoms, and he go able for take in your part. And also you need for pair up. If you know say you don't day in your 40s, you they go through that, they must get somebody where and they go together. Hey, when I saw me feel today, you go they advise you on and they exchange knowledge. So you need for pair up. Then also you need for they into social interaction. Not they you one no more. Try for belong to groups. Then one they discuss their woman thing, because we not say there are certain tribes or certain cultures where then they fear or shy away for talk about when it comes to reproductive issues. Then we need for the discuss about this, because this don't cause more problem in women them we don't marry 20-30 years ago, then maybe the last few years when they for live together. And remember say in the postmenopausal when I need now the 10 year and the man get more for do, because why the pikin don't married don't go now, two no more don't live. So na need for understand on ourselves and do all it takes, not to them for say I don't pass that side, I don't wash me and I don't wash me food. You get for create more bonding. And remember say we need for educate others, because ignorance will cause plenty spending, because every day you say I get malaria, I get typhoid, and which of course not to in the problem. Now you mood the swing and all others. Or ignorance also will cause broken homes, and ignorance don't make so many other things don't happen where you they get late intervention because you don't know. So wait till we end up for saying that be positive about you journey where you they go through by taking all the precautions where we don't say be fit at 40. strong at 60 and independent at 80. Try for boost your self-esteem. Talk over your sexual life with your partner. Talk over your sexual life with your partner. Families, they would expect una for support. The man, they would expect for support to una woman then doing the process here. Even the workplace, because the woman they at this age, they're still there in the working force. For law una give them the support during then time the way they're tired, they're not able to can work, as the case may be. I'm not saying this for the one the way still don't feel say they're not for work, then go just take as excuse. No, you actually they see those where they go through the menopausal thing when waiting really they tell on them, so man can just collapse or you just feel. So try for know the kind clothes where you for the way. If you not say where you wear this clothes, sorry, if heavy or they feel hot, not begin say this about dear our member you health, so let you not go collapse on. So let for the brace yourself pass mark, you're not able for blow, you go get an attack. So do you still active, you not retire yet, you don't dey at 60, members say you go strong, you don't dey at 80 with a hope and pray say you go be independent. So we want for wish una well. You we don't take your time for listening to we, or you we don't go through some of them things there, so but you be the things say na malaria, na typhoid, or any other thing. Remember say you need for go see your doctor and explain over, or you come people una dey the same age group and explain over, so una go learn more. As time they catch me now, I want for tell boku thank you to see Edna Boy, the staff midwife from Oladu in Children's Hospital. We don't taking time today. This 1 hour we not say really small for talk about well body business, but you don't taking time for kind talk to we viewers and listeners. Let we take them into serious part and try for educate others and keep on listening or watching the video, so you go able for understand better. I want to say thank you also to Joseph and to all Radio Maria family them and with viewers and listeners out there. See how you can say bye bye to people them so that we go wrap up the program.
Family them una bye bye. So now the word that's
not the voice of Sia.
Love beer with them. Not so because of them don't reach this stage here. For neglect we. So una day with you, una day by we side, as una been don't say till they do you part.
Yeah.
So bye bye.
So bye bye. Yeah. Till death do you part. Take control, picking them. Obey thy pay and there with them, support your mama and help her. You don't say they forget, always they take note of waiting, if they forget and some other things then. Yeah, you know say if they get there in hot flashes and all, you know say always need cold something, always be a support story. And the workplace, always be a support. You self we get yourself, remember your self-esteem and self-care, and remember waiting them you for it and waiting them now you limit. One for tell una thank you and stay glue. Next week, same time, same station. We left for now in the name of the Father and of the Son and of the Holy Spirit. Amen.